Home management of hypertension and coronary artery diseases. Ramesh is a 42-year-old office worker. He feels generally healthy but often complains of headaches and tiredness, which he ignores due to work pressure. He eats outside food frequently, hardly exercises, and believes heart problems happen only in old age. During a routine health camp, his blood pressure is found to be 160/100. Further tests show high cholesterol levels. Ramesh is shocked because he had no serious symptoms. This situation is very common and highlights why hypertension and heart disease are called silent killers. Hypertension, commonly known as high blood pressure, and coronary artery diseases are major causes of heart attack, stroke, kidney failure, and early death. Many people live with these conditions for years without knowing it, because symptoms may be absent or very mild. Hypertension can begin as early as the late teens or early 20s, especially in people with family history, obesity, high salt intake, stress, or sedentary lifestyle. The risk increases significantly after 40 years of age, making regular blood pressure screening essential from young adulthood. According to guidelines, hypertension is diagnosed when blood pressure remains persistently 140/90 mmHg or higher. In people with diabetes, kidney disease, heart disease, or previous stroke, 130/80 mmHg is considered high. Once treatment is started, the target blood pressure should be below 140/90 mmHg for most adults and below 130/80 mmHg for high-risk individuals, if tolerated. In elderly patients, BP should be reduced gradually. Home management. Regular monitoring is essential. Blood pressure should be checked at home using a digital BP machine and recorded in a BP diary. Body weight, heart rate, and blood sugar should also be monitored. Sudden weight gain may indicate fluid retention. Medicines must be taken exactly as prescribed and never stop suddenly. BP becomes normal because of medicines, not because the disease has disappeared. Dietary control plays a major role. Excess salt intake must be avoided. Salt intake should be limited to less than 5 g/m, day 1 teaspoon. High-salt foods include canned foods, ready-to-eat meals, sauces like soy sauce and ketchup, junk foods containing MSG, instant noodles, pizzas, burgers, and momos. Bakery items such as biscuits, bread, cakes, puffs, and pastries contain baking soda or baking powder, which are hidden sources of sodium. Indian foods like pickles, papad, farsan, chutney powders, and salted snacks should be limited. Healthy Indian snack options include roasted chana without salt, sprouts chaat, roasted makhana, fruits, boiled eggs, paneer cubes without salt, curd with fruits, idli, upma, poha, and vegetable sandwiches prepared with minimal oil and salt. Regular physical activity is essential. Brisk walking means walking faster than normal, causing mild sweating and faster breathing while still being able to talk. At least 30 minutes daily is recommended. Office workers can use stairs, walk before or after work, and stretch during breaks. Housewives can stay active through sweeping, mopping, gardening, spot walking, yoga, and pranayama. Maintaining healthy weight, managing stress, getting adequate sleep, stopping tobacco use, and limiting alcohol are crucial lifestyle measures. Regular follow-up tests include blood pressure monitoring, lipid profile, blood sugar, and HbA1c, kidney function tests, liver function tests, electrolytes, ECG, and echocardiography if advised. Who all at risk? People above 40 years, those with family history, obesity, unhealthy diet, physical inactivity, smoking, alcohol use, diabetes, high cholesterol, kidney disease, chronic stress, night shift work, and frequent outside food consumption are at higher risk. Hypertension may have no symptoms or may present with headache, dizziness, blurred vision, fatigue, or palpitation. Coronary artery disease commonly causes chest pain, breathlessness, sweating, nausea, or pain radiating to the arm or jaw. Uncontrolled disease can lead to heart attack, stroke, heart failure, kidney failure, vision loss, and sudden death. MYTHS and facts. Q. I feel normal. Does that mean my BP is normal? A. No. Hypertension often has no symptoms. Q. Is high BP only an old age disease? A. No. It can start in young adults. Q. Can medicines be stopped once BP is normal? A. No. Stopping medicines can cause serious complications. Q. Does only added salt increase BP? A. No. Hidden salt in packaged and bakery foods is a major cause. Q. Does heart attack always cause severe chest pain? A. No. Women, elderly, and diabetics may have atypical symptoms. Conclusion. Hypertension and coronary artery diseases are silent but preventable. Regular BP checks, healthy low-salt diet, daily physical activity, stress control, quitting tobacco, and strict medication adherence can prevent life-threatening complications. Final message. Check BP regularly, take medicines daily, eat less salt, stay active, and protect your heart.